Random testing will continue tomorrow in Essex at the Arena from 9 to 5 p.m. Any resident of Windsor-Essex 12 years of age or over can be tested. People will need to provide a health card number, first and last name, date of birth, and address. Please check the Ministry of Health's online portal or the link on our website to access your test results. I will now share the most current case counts. There are 90,947 confirmed cases of COVID-19 in Canada and 27,859 cases in Ontario. Chatham-Kent has 145 cases, and Sarnia-Lambton has reported 263 cases. Michigan now has 57,397 cases, with 11,041 cases being in Detroit. Today, we are reporting 970 cases of COVID-19 in our community, an increase of 2 cases from yesterday. 496 cases have resolved, and 17 people are in hospital. 18% of our cases are between the ages of 20 and 29 years, 18% are between the ages of 30 and 39 years, and 16% of our cases are 80 years or older. 48% are male, and 51% are female, and 1% is unknown. Our community has now lost a total of 65 people to COVID. 48 deaths have occurred among residents in long-term care and retirement homes. Our health unit is currently working with 2 long-term care and retirement homes that are experiencing a COVID-19 outbreak. Testing is available for symptomatic people, those who have at least one symptom of COVID-19, even mild symptoms. And testing is also available for asymptomatic people based on their level of risk, including people who are concerned that they've been exposed to COVID-19, people who are contacts of a confirmed case, or may have been exposed to a confirmed case or a suspect case of COVID-19, and people who are at risk of exposure due to their employment, including essential workers such as healthcare workers, grocery store employees, and people working in food processing plants. No one who is symptomatic or who is concerned that they have been exposed to COVID-19 will be declined a test at an assessment center. Common symptoms include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olet Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. The Windsor-Essex County Health Unit is reporting 20 additional cases of COVID-19 since Friday, May 29th. The Windsor-Essex County Health Unit reported 6 cases Saturday, May 30th, 12 cases May 31st, and 2 today, June 1st. I regret to inform the 2 deaths today. A female in her 80s. She was a resident of a long-term care home and died at the field hospital. This will be the 15th person who died at the field hospital. My thoughts and prayers are with the family. My team and I are truly sorry for their loss. In addition, I'm also reporting the death of a temporary foreign worker in our region. The worker was in his 30s with no pre-existing medical condition. He came to Canada in February 2020 and was working in the area farm and was diagnosed with COVID-19 and was self-isolating in a motel. My team and I are truly sorry for the death of this young temporary foreign worker. Just like I have said it before many times, every life lost is a tragic loss to our community. These deaths are not just a number to me or to anyone here in my team. It is a person, it's a loved one for their family. I want to express my true sympathies to the family of this temporary foreign worker and to others who have lost their loved ones to COVID. The tragic death of these temporary foreign workers and the recent increase in the number of cases in these workers are bringing the focus back on these migrant farm workers or temporary foreign workers. Windsor-Essex is a home to a large number of farms and greenhouses that employ over 8,000 seasonal workers. Every year, the municipalities welcomes temporary foreign workers to our communities, supporting food production in the region that provides food not only for our region but also for the province. These temporary foreign workers come to Canada under a federal program with the specific requirements from Government of Canada to ensure the safety and well-being of these workers. On March 20th, the federal government announced an exception to the temporary foreign workers program to ease travel restrictions so that they can come here and participate in the food production industry in the region and also across the province. Since the announcement, we worked with all our partners to ensure that all these temporary foreign workers arriving in Canada meet the 14 days self-isolation quarantine requirement. Under the Temporary Foreign Workers Program, housing and day-to-day transportation for these temporary foreign workers is the responsibility of the employer, and they must ensure that they are meeting the public health requirements and other restrictions under the Emergency Management and Civil Protection Act. Temporary foreign workers, similar to all residents in the community, must follow all the requirements set out under the Emergency Management and Civil Protection Act, including physical distancing, self-isolation, and limitations for social gatherings. The specific role of the health unit is to ensure regular inspection of the bunkhouses, provide education, and collaborate with health and social services partners on a regular basis to support these workers. The Windsor-Essex County Health Unit inspected all these accommodations to ensure they meet the requirements as set out by various ministry guidance documents. A few weeks ago, there was a video that was circulated on various social media platforms expressing concerns about the living arrangements for these workers. The health unit initiated the investigation and followed up on those concerns to ensure appropriate measures are in place to ensure that all the housing arrangements or the housing needs are meet the public health requirements as per ministry guidance and other guidance documents. We'll continue to investigate and address any other public health related concerns with this population, and we will provide all the support that is needed to protect these vulnerable population. In order to get ahead of the things, the team at Windsor-Essex County Health Unit worked closely with the Ontario Greenhouse Vegetable Growers, OGVG, local farm operators, the municipalities, and the Erie Shores Healthcare Hospital for various public health and acute care needs of this population. One of the key areas that public health is involved with these farms is to control the spread of all diseases of public health significance, including COVID-19, tuberculosis, sexually transmitted infections, chickenpox, and many more. Even before we had our first case of COVID-19 in our region, we proactively worked with all the partners to ensure that employers and employees have up-to-date and accurate information regarding roles, responsibilities, and actions needed to ensure the protection of communities and mitigate risks associated with COVID-19. We also ensured that we have all the information translated in all the languages these temporary foreign workers speak and arranged translators to assist us in follow-up and data collection. As we continued with our case and contact management of these cases in temporary foreign workers, we came across with some challenges, and that led me to issue an order under the authority of the Medical Officer of Health to all the agricultural farm owners in the region to ensure that they follow all the public health guidance and meet all the requirements to ensure that the workplace is safe, and also to ensure that the employers take appropriate actions to keep the workplace safe and provide safe accommodations to anyone if they develop any symptoms related to COVID and are appropriately isolated to protect everyone around them. Once a single case is identified, the Ministry of Labor initiates an investigation to ensure that the workplace is doing everything to protect their employees and meet all the requirements laid out in all the protocols and the guidance document. If these cases and contexts require self-isolation in an accommodation, for example, a motel, our inspectors go to these motels to ensure that it meets the protocol and guidance as well. In some situations, given the number of cases and their close contacts, the workers are cohorted or segregated just like the long-term care home to keep positive cases with the positives and all the negatives with the negatives. All high-risk contacts of the case are kept in self-isolation to protect other workers. In addition to self-isolation, the health unit is also testing all the high-risk contacts of a confirmed case. Employers participating in the Temporary Foreign Workers Program are also subject to compliance inspection by Service Canada investigators to ensure that all necessary and appropriate measures are being taken to reduce risk and limit the spread of COVID-19. The Windsor-Essex County Health Unit public health inspectors and infectious disease department nurses are in regular and in constant communication with farm operators to provide education, support, and monitoring, including provide tools and resources in various languages, interpreter support to help connect with these individuals to ensure timely flow and accurate flow of information. In addition, the Windsor-Essex County Health Unit has worked closely with Erie Shores Healthcare to develop protocols for early assessment, isolation, and testing of temporary foreign workers for COVID-19 and any acute clinical care that they need. In order to be more proactive, we are working with our partners, for example, the Essex Windsor EMS, Erie Shores Healthcare, and Windsor Regional Hospital, to expand it and do more in-person assessment of all these confirmed cases who are self-isolating and all the temporary foreign workers who are self-isolating in these motels and bunkhouses. This will allow us to identify any healthcare need of these workers on an ongoing basis and address it appropriately, including any transfers needed to the hospital for further assessment and management. For more information about COVID-19 and temporary foreign workers, please visit our website, www.wechu.org. You can also visit the Government of Canada's website for Temporary Foreign Workers Program. Before I finish today's briefing, I would also like to inform everyone who is concerned about any of these issues to please reach out to us, my team, and myself. We are available to address any concerns or questions that you may have with any of the things that are happening with respect to the public health management of these temporary foreign workers or any other vulnerable group, and we'll be more than happy to share our perspective on these issues. I am accessible, and I want to make sure that everyone is aware that my team is also accessible to hear directly from any members of the community, any groups, to address any concerns you may have. Thank you.
We'll now take questions from the media. We'll start with the Windsor Star.
Can you provide a breakdown of the most recent 20 cases? Were they community spread or majority agricultural workers?
Most of them are agricultural workers, and even the last two ones are, I think, one is a community and one is an agricultural worker. I can provide more details as part of our epi-summary, but in total, most of these cases that we are seeing they are all contacts rather than the actual community transmission.
Thank you.
Any questions from CBC?
Yes, good morning. The worker that was self-isolating, did they end up going to the hospital after their symptoms obviously got much worse?
Good morning. Yes, the worker called the EMS and was taken to the hospital where he was later pronounced dead.
So how much time did he spend in the hospital?
I don't have that exact breakdown, but he was taken to the hospital, and the clinical course, I don't have that information available. The hospital would be in a better position to answer that question.
Is there somebody with the health unit that's speaking to these migrant workers that are in self-isolating to let them know what their options are if they start to get worse?
Yes. Every time any of these workers are self-isolating, our team gets in touch with them on a regular basis, almost daily, and we do provide them with translation service. We do get the support of the interpreter. We do provide them with some written information in their own native language to help them understand all the details, what's next step to do, how to reach out to us, to EMS, or to call for help if they need any of these things. And we do monitor symptoms. If there is any assessment that is made on our end that this person requires additional assessment, we arrange that assessment, or either have them go to the assessment center, or connect them with the appropriate people. And so that those conversations happens regularly with everyone, with the interpreter support as needed, and that work continues to ongoing with all the positive cases that are self-isolating right now.
What country was this person from?
This person was from Mexico.
Are you able to say what farm he was working at, or?
As I said, it's doesn't really matter where these farms are. It's a loss of life, and we should be respecting everyone's privacy. And the next of kin is not here, so the farm will be working with the consulate to share that information with the families and do what is needed.
Thank you.
Any questions from Blackburn?
Yeah, I just noticed at the beginning when you were talking about the number of tests completed, I thought there's something about like 18,000, but then on the website it says 16,000. So is that not including the random testing that was done this weekend?
Yes. So there are a lot of testing that's happening, which is getting more challenging for us to track down. So we'll have to take a look at that, how we can report it accurately. And short answer, yes. So what you're looking at the website, it is not inclusive of that number because we did a lot of random testing over the weekend, and that number is not included in that list.
Okay, so then the pending tests are also not including the random tests?
That is correct, yes.
Okay.
Any questions from CTV?
Yeah, just wondering, do you feel like you're getting a handle of what's going on in the agribusiness right now? Like, are we still early in that curve, or have we done enough measures now that we might see a shift in what's happening?
So I think given the number of farms and then given the number of farm workers that we have, the best focus is on the prevention side, because obviously prevention will prevent any of these cases. And once we identify a case, obviously we are on top of it and identifying all the close contacts, anyone who needs testing as part of that potential exposures, they are being tested. Anyone who has come in contact based on the orders that we have, they are to be self-isolated. These workers are not working in multiple farms. So we do have some of these measures in place, and we'll continue to revisit and see how we can make it better. But we have to recognize that this is a very challenging population. There are multiple responsibilities, levels of governments involved, and a lot of these requirements that are being set on these employers by the governments, by us, is they are meeting all of these requirements. But what happens with the human behavior, many of these individuals are coming from a different social cultural background. They may not necessarily follow all the recommendations and advices that we are providing them. So we do our best to do that translation, to do that interpreter services, to make sure that we are culturally appropriate in terms of how we are connecting with them. So I think all those works are happening, and we are seeing some improvement. Are we out of it? I don't know, but I would like to see that these measures are showing the results. The number is adding up, which is concerning, and we'll have to focus more on all these aspects, especially from the prevention side, and then early diagnosis and self-isolation piece, and then moving forward from what other lessons we can learn to be more proactive. One of the things that I mentioned is working with the EMS and with the hospitals to go and do some proactive testing. So instead of this person reaching out to EMS and calling, what can we do proactively to maybe do that assessment, like a physical assessment in person. Our nurses do make that connection, but those connections are over the phone. It's not an in-person assessment. And if there is any need, if there is anything that we can do and have the ability to provide that in-person assessment, so we'll be looking into that as well.
One more, just your overall feeling on this weekend and your drive-through and how that went, and what kind of expectations do you have in Essex tomorrow?
So we really got a good result from the drive-through testing, and I'm really pleased with the support that we have received. All the agencies that came out to help us with our logistics, the City of Windsor staff were amazing. Their Parks and Recreation Department, they came out and provided with all the support that from the logistic perspective. The Windsor Police, they came out to provide us with the traffic logistics and ensuring that everything is happening properly. We got lots of volunteers from Schulich School of Medicine, the medical students from different years. They came out, and I want to thank them for taking the time and come out. Many of our staff volunteered to be there. I myself, Teresa, was there as well over the weekend to help with some of the work, and it was amazing. We got so many people who came through the drive-through, and it was really busy. So we felt that it is important for us to be on site and to provide that logistics to help ease the traffic flow. And on Sunday it was even better. So obviously we learned every day that what we can do to smooth the process. So that work is ongoing, and we hope to go out to the community, to the counties starting tomorrow. And we'll try to be there at least in neighboring municipalities to capture some of these same individuals who may not necessarily would go to the assessment center, but maybe come to a drive-through site. And that's the hope, that we will get the numbers that we are hoping to. Initially, I think it was 2,300 or 2,400 that we were targeting, but I'm confident that we'll get more than that.
Any questions from AMA 100?
Do you know when this foreign worker who passed away, when he was diagnosed?
So this particular worker, he was diagnosed May 21st, and then he passed away the night of Saturday.
And just to clarify, I know at one point you wanted all residents and long-term care home staff tested. Have all temporary foreign workers locally been tested? Has there been a sweep there?
Not at this moment. Right now, it's the testing we are doing is as we are working with this population. So anytime we have a case, we are expanding our contact investigation, and we are doing the testing in all the bunkhouses that these positive cases are in, and also in some sections of the farms where these workers are working and coming in contact with other people. So those testing are so far limited to there. Should we be expanding testing to everyone? We're talking about 8,000 to 10,000 people, and from a public health case and contact management perspective, we are doing the targeting testing at this point. At some point, if there is a more direction to test all these people, with the caveat that these are all the tests that will give us a point-in-time estimate, and as long as we understand that what it means and how it can be used, testing these people today even doesn't predict what will happen tomorrow. They can easily go out tomorrow again and then get infected. So we really have to be careful in how we are understanding this information and how we are using this information. So right now, from a risk perspective, we are doing proactive testing for anyone who is a contact or who comes in contact with these individuals to self-isolate and to test them to get a better handle of what the situation is.
You mentioned that he was in his 30s. Does that make him the youngest victim of COVID-19 in this area?
In our community, yes.
And you said he was in his 30s?
That is correct.
Any further questions from the Windsor Star?
No, thank you.
CBC?
Yes. When it comes to the video, you said that the health unit went to investigate. Did you find that video accurately portrayed the conditions of the bunkhouse?
So this video, I believe, was taken before at the time when they were quarantining, and those were the time when they just stayed in that temporary location for that time period. And so we connected with the facility, with the owners, to ensure that they have the right guidance and they are following what they're supposed to do. And we are confident that whatever was happened, I can't say that whether it could have been prevented, but what we know that they are all aware, and we'll continue to work with them to ensure that they are taking care of all these people the way it should be, as laid out in all the protocols and all the guidelines, and they are following all these recommendations and are compliant with that.
Thank you.
Any further questions from Blackburn?
No, thank you.
CTV?
Just curious, are there discussions on maybe doing a second sweep in the long-term care retirement home facilities?
Well, the ministry is taking a lead in terms of the expanded testing protocols. So right now, and even when Teresina was asking about the congregate setting, so some of these directions and initiatives are coming from the ministry. So they are working closely with some of the other key health system partners to develop a plan that can be implemented to help public health focus on our core work on case and contact management. We are not the ones who do all these testing all the times. We do those targeted testing because of the need from a risk perspective to the community, recognizing that there is this capacity and then the ability for the system to do those testing. So that's why the ministry is taking the lead on it to ensure that appropriate resourcing can be done. All the logistics from swabbing to the lab and everything is taking place appropriately. So hope is they will share all those details. I am aware that some of these conversations are going, but I haven't seen a plan yet. Hopefully this week and moving forward, it will come directly from the province and identifying the appropriate partners who would be engaged in this type of testing.
Is that something you'd like to see?
Well, I guess, as I said, ideally, if we do have the capacity, especially from these type of settings, if we can get to the point of care testing every day, if you're testing, that's better. But even any time that you are doing this type of serial testing, it's a point and estimate in time. And do we have the capacity to, let's say, go back in next week and then another week and then another week, and how long we are doing that? So I think those are the questions that the ministry is trying to work at and trying to come up with a plan and to identify what is best. If it's up to me, and if I do have the capacity and I do have the ability, unless we get to the point of having a vaccine or do these type of mass vaccination for all these essential workers, if they are in this type of high-risk settings, if you have the point of care testing, test them every morning. But and then again, going back to the same message, that what are we doing and what this message can be used. So this message, if we are doing testing every day, the message is clear that this is for today. Tomorrow you'll be tested again. Tomorrow you will be tested again. And then that doesn't take away any of the recommendations that we are providing every day from a public health perspective, such as physical distancing, staying home when you're sick, or taking any other care that you need to protect yourself and your family. As long as we are really, really clear on all these messages, I have no concerns about doing the point of care testing every day. But I truly don't want to be in a position where anyone is confused in terms of, if I get tested, I'm negative, that means I am fine and I don't need to take any other precautions. And if I am doing that, I'm losing my guard, and that's why some of these cases are continuing to happen in some of the institutions. And that is something that I am trying to explain as best as possible to everyone, to understand what this test means and how these tests should be interpreted, and what is your role, what is your responsibility in preventing and limiting the spread of COVID-19.
Any further questions from AMA 100?
No, I'm okay. Thank you.
I have a question from Radio Canada, please.
Okay.
Thank you. Hi. So last week you received a letter from an organization that pointed out the fact that some migrant farm workers live in overcrowded homes, for example, or work in companies that do not comply with sanitary measures. Have you since contacted the organization, and do you plan to work with them to find out whether or not a company does not comply with sanitary measures?
So I already reached out to the individual who sent that letter to me, and I have I'm trying to set up a teleconference with that person, and we'll try to work together whatever concern that he has, and go through our roles and our responsibility, and see how we can support the cause. And if it's something that we can do, we'll do it. And but just wanted to get a better sense and better understanding of what those specific concerns are and how we, from a public health perspective, can support those concerns.
Thank you. And so you said that Service Canada is involved. Also, did I understand well when you did you said that they do also that they also check that they also set up inspections?
So the Ministry of Labor, because the farms that we are talking about, it's a workplace. So any workplace issue is a Ministry of Labor issue. If any farm have a case, the Ministry of Labor inspection is automatically triggered. They go into this farm and they inspect the workplace for their safety. This is not a public health role. This is a Ministry of Labor role, because this is a workplace, and the Ministry of Labor go into these workplaces to ensure that the employers and all the safety protocols are in place to protect these workers from contracting the disease in the first place, or any other type of occupational health and safety related issues that they can see. So any kind of workplaces issue, it is under the jurisdiction of Ministry of Labor to come up with all these recommendations and guidance. They do connect with us for some of the public health expertise as needed, but that's typically the Ministry of Labor's responsibility to go and do all of that work. From a public health perspective, what we are focusing on is the case and contact management of all these cases. And when they are self-isolating, we want to make sure that the accommodations that where they are self-isolating, whether it's a bunkhouse, whether it's a motel, it is safe and it meets the various requirements from the different levels of government, whether the provincial requirement or municipal bylaw requirement, safety requirement, public health requirements, and if all those is met, that's what we focus on. And from case and contact management, we also want to make sure that they are following the recommendations and directions of public health.